Hey y'all, my name is Daniel Anderson. I have been working with Dr. Jones this semester again, and I'm going to be recording the lecture content for Chapter 23, Substance Related and Addictive Disorders. We are utilizing the PowerPoint created by Dr. Holliday with some additional information, and we will discuss this content in class as well. So substance-related disorders is comprised into two groups. We have substance use disorders, which is addiction, and then we have substance-induced disorders, which includes things like intoxication, withdrawal, delirium, neurocognitive disorders, psychosis, bipolar disorders, depressive disorders, obsessive compulsive disorders, anxiety, sexual dysfunction, and sleep disorders. When we're looking at this content, we need to think of the term drugs in several different ways. Drugs are a pervasive part of society. We have socially acceptable mood-altering substances like alcohol, caffeine, nicotine. We have substances that have medical purposes. We have our central nervous system stimulants like amphetamines. We have central nervous system depressants like tranquilizers and sedatives. And then we also have our over-the-counter medicines that are designed to relieve both real and imagined ailments. We also need to think about illegal substances. There are some of these substances that are more socially accepted than others. We have things like marijuana, which is becoming legalized and it is more socially acceptable. And then we have more dangerous illegal substances like LSDs, cocaine, and heroin. And also when we're thinking about illegal substances, we have to think about opioids, both prescribed and illegally purchased. So the first part of this content is going to talk about substance use disorders, which is addiction. Addiction is a compulsive or chronic requirement. There is a need that is so strong that it generates distress, either physical or psychological, if it's left unfulfilled. So with this, the use of the substance interferes with the person's ability to fulfill role obligations. There may be attempts to cut down or control the use, but these are often unsuccessful. There's an intense craving that leads to an excessive amount of time spent trying to produce the substance, and recovery usually takes a long time. In addiction, we see persons who have difficulty with interpersonal relationships. These people are usually engage in hazardous activities, which are often impaired by the substance. We do see where these individuals do develop some sort of tolerance, requiring more of the substance each time. And a lot of times the symptoms associated with the substance use is very specific to the drug that they're currently addicted to. So we've talked about substance use disorders, which is addiction. So now we're going to move more into the substance-induced disorders. So you see we have intoxication and withdrawal. Intoxication is a state of disturbance in cognition, perception, behavior, level of consciousness, judgment, and other functions that is directly attributed to the effects of a psychoactive drug. Intoxication is the development of reversible syndrome following excessive use of a substance. These symptoms are drug specific. These symptoms usually occur shortly after ingestion of the substance. The central nervous system is directly affected, so we see both physical and psychological disruption and functions. So these patients, they'll have a judgment that is disturbed. This can cause inappropriate or maladaptive behaviors. And we also see social and occupational function impairment. Withdrawal, on the other hand, is the psychological or mental readjustment that accompanies the discontinuation of an addictive substance. So withdrawal occurs upon abrupt reduction or discontinuation of a substance that has been used regularly over a prolonged period of time. There are physical signs and symptoms that are substance specific. And we see psychological changes such as a disturbance in thinking, feeling, and behavior. Your textbook goes into some of the predisposing factors associated with addiction and substance-related disorders. The first one listed is biological factors like genetics. This is especially common in alcoholism. Children of alcoholic parents are 4 times more likely than other children to become alcoholics. And you can see that genetics accounts for 40 to 60% of a person's vulnerability to become an alcoholic. There are also some inheritable personality traits associated with addiction. These are things like a high novelty seeking or a low harm avoidance personality. Also, things like lifestyle factors influence addiction. Things like diet, exercise, and the types of social activities you're involved in all influence the likelihood of addiction. We won't get into the specifics related to other factors associated with addiction, but just know that there are psychological factors such as developmental influences, personality factors. Certain personality traits are more susceptible to addiction. We discussed the inheritable personality traits on the previous slide. And also cognitive functions, such as irrational thinking patterns. These are all play a factor into addiction and then substance related disorders. Again, more predisposing factors associated with addiction and substance related disorders, sociocultural factors such as social learning, conditioning, and cultural and ethnic influences all impact a person's likelihood to become addicted. The first substance that we're going to discuss is alcohol and alcohol use disorder. Alcohol is a natural substance formed by the reaction of fermenting sugar with yeast spores. Alcohol is classified as a food because it has calories. However, it does not have any nutritional value. Most alcohol is metabolized by the liver, which produces acetylide, which is then broken down further into aldehyde dehydrogenase, which is an enzyme. This enzyme causes central nervous system depression, and in higher concentration affects the blood pressure and produces that flushing, nausea, and vomiting. There are 4 phases associated with alcoholism. We have phase 1, which is the pre-alcoholic phase. In this phase, you'll see patients who use alcohol as a means of relieving their everyday stresses and tensions. Phase 2 is the early alcoholic phase. In this phase, we'll see patients who experience blackouts or brief periods of amnesia during or immediately following a period of drinking. For this patient, alcohol is no longer a source of pleasure or relief, but is actually a drug that is now required. Phase 3 is the crucial phase. During this phase, there's a loss of control over the patient's alcohol use. There is a full-blown psychological addiction. The patient is unable to choose whether or not they drink each day. And a lot of times these patients will do what's called binge drinking, and that binge drinking will result in a loss of consciousness. You'll see evidence of squalor and degradation. Like these patients are very ill presenting. And also during this phase, you will see episodes of anger and aggression. The final phase of alcoholism is phase 4, which is the chronic phase. You'll see a lot of emotional and physical degradation in these patients. Often these patients are intoxicated most of the time. They're intoxicated more than they are sober. You'll see a lot of personality traits associated with like helplessness and self-pitying. And there's also a lot of psychosis or just like an impaired reality testing. And then we'll also see life-threatening physical manifestations, which can affect every body system. Your textbook does a good job of breaking down each of the body systems and how alcohol affects them. I've listed here several of the key points for each body system. You can review those, but also make sure that you do read the content so that you're able to identify any clinical signs that might point you towards alcoholism. Fetal alcohol spectrum disorder is a big topic in alcoholism and in healthcare. Fetal alcohol syndrome affects an infant's ability with learning, memory, attention span, communication, vision, and hearing. This slide lists some of the manifestations or characteristics of fetal alcohol syndrome. You can see the image here of the small child. But with these patients, we'll see the abnormal facial features, small head size, short height, low body weight, poor coordination, hyperactive behaviors, difficulty paying attention, poor memory, learning difficulties, speech and language delays, intellectual disabilities, poor reasoning skills, sleeping, sucking problems as a baby, vision and hearing problems, and then also problems associated with the heart, kidneys, and bones. This is some numbers to remember. Alcohol intoxication, blood count levels between 100 to 200 is considered alcohol intoxication. And then also remember that with alcohol withdrawal, these symptoms occur within 4 to 12 hours after stopping or the reduction of heavy drinking. The next group of drugs that we're going to discuss are central nervous system depression drugs. So these drugs are diverse chemical structures that induce varying degrees of central nervous system depression. This can be things from simple tranquilization of anxiety to anesthesia, coma, and even death. A lot of times these drugs are used in combination with each other or even with alcohol, and then the depression effects are compounded, which means that the effects are unpredictable and can even be fatal. Some of the physiological aspects associated with long periods of central nervous system depression, we get into a central nervous system hyperexcitability once we withdraw that drug. This can cause severe responses from convulsions to even death. And then we have our psychological associations with this type of addiction, which generate a psychic drive. And so this can cause the patient to achieve maximum functioning or feelings of well being. We also see a cross tolerance and cross dependency with central nervous system depressants. Cross tolerance, of course, would mean that there's a condition where the individual becomes resistant to the drug's effect. And then cross dependency is a condition where the individual becomes dependent on the drug's effects. When we think about how these drugs affect the body, we need to remember that these are general depressants, so they cause depressant effects. With our central nervous system, we will see things from mild sedation all the way to death. Respiratory system, these drugs will inhibit the rectal activity of the system. With cardiovascular system, we will see hypotension or even a compromise in the cardiac contractility and vascular tone. This can be very dangerous as prolonged use of these depressants could cause cardiovascular collapse. With our renal system, we see a reduce in urine output. With our hepatic system, these drugs can inhibit the metabolism of other medications. Thermoregulation, this relates to body temperature, so these depressant drugs will actually decrease the body temperature. And with sexual function, there is initially an increase in libido, which is followed by an impaired sexual pleasure. For men, this could be a decrease in the ability to maintain an erection. So moving from our depressant drugs, we're going to look at some of our stimulating drugs and stimulant use disorders. So these drugs excite the entire nervous system. We will see with the central nervous system, your patients will present with tremors, restlessness, anorexia, insomnia, agitation, or an increased motor activity. With the cardiovascular system, we see an increase in both the systolic and diastolic blood pressures. There's an increase in heart rate and also an increase in cardiac arrhythmias. These drugs cause vasoconstriction. With our pulmonary system, the drugs actually relax the bronchial smooth muscles. This increases our oxygen consumption, but also increases our oxygen demand. With gastrointestinal and renal systems, there's a decrease in your GI motility, which causes things like constipation. And some of these drugs actually have diuretic effects, while others can reduce the excretion of urine. And some of them actually have a small rise in metabolic rate, so they can cause varying degrees of anorexia. As far as sexual function, these drugs, we actually see an increase in sexual urges in both men and women. It's like a aphrodisiac effect. Our next group of substances is going to be opioids. So, opioid refers to a group of compounds that include opium, opium derivatives, and synthetic substances. Opioids exert a sedative or analgesic effect on the central nervous system. We use these a lot in healthcare for pain relief, even things like treatment of diarrhea, and then relief of coughing. These drugs cause pleasurable effects, and tolerance may lead to addiction. They can be administered by oral ingestion. We also see them being used snorting, smoking, and injection. On average, 130 Americans die every day from opioid overdose. So, how do opioids affect the body? With our central nervous system, we see a euphoric effect. There's mood changes, but this can also lead to things like mental clouding, drowsiness, and then we also see the pain reduction effects. With our gastrointestinal system, your stomach and intestines actually see an increase in tone, but a decrease in the peristaltic activity. So this leads to things like constipation and fecal impaction. With our cardiovascular system, it's important to know that we do use opioids for cardiac treatment for things like heart attacks, chest pain, even with pulmonary edema. But in high concentrations, opioids can cause hypotension, cardiac dysrhythmias, and even lead to death. As far as sexual function, opioids cause a decrease in sexual function and libido. And also with like long-term use, we do see erectile dysfunction in men associated with opioid use. Our next group of substances will be cannabis, which is actually the most common illicit drug in the United States. Cannabis is prepared as marijuana, hashes, there's synthetic cannabinoids, CBD, and then there's also FDA approved medications. 4 to 5.3% of Americans aged 12 and up have used marijuana or hashes in their lifetime. The majority of people who use marijuana do not go on to use harder substances. So, how does cannabis affect the body? With our cardiovascular system, cannabis actually causes tachycardia and also orthostatic hypotension. With our respiratory system, initially cannabis will cause bronchodilation, which facilitates respiratory function. But with chronic use, we see results of obstructive airway disorders. This is associated with the high tar concentration with marijuana and also the common practice with smoking marijuana to hold in as long as possible to increase the effects. We also see these patients with laryngitis, bronchitis, cough, and hoarseness. With reproductive systems in men, there is a decrease in sperm count, motility, and structure. And in women, there is a suspension of ovulation, disruption of menstrual cycles, and alterations in hormone levels. With the central nervous system, it's all related to the dose amount. It can be anything from that high feeling, which is kind of like being intoxicated. It's just the euphoric effect. There's a relax inhibitions. Sometimes there's the disorientation, depersonalization, and then relaxation. And then higher concentrations can lead to sensory alterations, such as impaired judgment in time and distance, recent memory loss, and decreased learning abilities. There's also a syndrome associated with cannabis. That's the Amotivational syndrome, which is a lack of motivation to persist in or complete a task that requires ongoing attention. As far as sexual function, cannabis is actually reported to increase the sexual experience, even though we do see a decrease in, again, the reproductive system and the reproductive ability. So how do we relate all the information we've learned about substances to the nursing process? The first part of the nursing process is assessment. So when we're assessing our patients, we're going to look for those signs of substance use disorder and addiction. We're going to need to examine our patients based on how we know these substances affect the body. It's also important that when we assess these patients, we also examine our own feelings about working with clients of substance abuse. Remember, a lot of these drugs are illegal. There's a lot of stigma associated with people who use substances. So it's important that we remember to remain unbiased and to provide equitable care to all of our clients. The textbook also goes into various questioning for whenever you're interviewing your patient. And it's very important that we remain unjudgmental and to ask questions appropriately and make sure that we have a patient-centered approach and use encouraging, empowering, and active engagement. There are various assessment tools that have been standardized for assessing patients with potential addiction or withdrawal. These are listed in the textbook. There's actually a table that goes through CIWA, which is the Clinical Institution Withdrawal Assessment of Alcohol Scale. Make sure you review those. We also have the CBIRT, which is Screening, Brief, Intervention, Referral, and Treatment Plan. Again, these are nationally developed and they're updated constantly, and they utilize evidence-based practicing for the treatment and assessment of patients with substance use disorders. So after we've made our initial assessment of our patients, our diagnosis, planning, and implementation of interventions is all going to be specific to the substance being used and the risk factors associated from our assessment. So your textbook goes in through various risk factors that we apply as nurses for substance abuse patients. And those are listed here, and we're going to talk about some of the short-term and long-term goals for these patients. So after your assessment, if you find that your patient is at risk of injury, this is that they're subject to physical damage due to environmental conditions, interacting with individuals' adaptive and defensive resources. So if we think about this patient and their goals, a short-term goal for this patient would be like a 72-hour stabilization. And then the long-term goal would be the patient experiences no physical injury. Denial. This is an attempt to disavow knowledge or meaning of an event, to reduce anxiety and or fear, leading to a deterrent of health. For a denial patient, our short-term goal would be to help the patient focus on behavioral outcomes associated with the substance use. And then our long-term goal, to have the patient verbalize an acceptance of their own responsibility of behavior and acknowledge the association between substance use and personal problems. Ineffective coping is another potential nursing diagnosis for substance use disorders. With ineffective coping, our short-term goal would be to have the patient express their true feelings about using substances as a method of coping with stress. And then our long-term goal, have the patient verbalize the use of adaptive coping mechanisms in response to stress instead of substance abuse. Dysfunctional family processes is another nursing diagnosis. For a short-term goal, the family participates in individual family programs and support groups. They're able to identify ineffective coping behaviors and consequences, and the family initiates and plan for necessary life changes. A long-term goal for the dysfunctional family processes, the family takes action to change their self-destructive behaviors, and they alter their behaviors that are contributed by the addiction. Then the last step of our nursing process is evaluation. So we'll need to reassess our patient. We'll need to determine if our interventions have been effective in achieving both our short-term and long-term goals. Evaluations can be accomplished by using information gathered from the reassessment questions. Again, refer back to your textbook for those evaluation questions. Make sure that we're using verbiage that is not degrading, not judgmental, but that we also always are encouraging, optimistic, and using effective communication. So we can't talk about substance abuse and addiction without talking about the chemically impaired nurse. So we've learned that substance abuse and addiction can potentially impair an individual's social, occupational, psychological, and physical functions. This is especially serious when that person is responsible for other people's lives, i.e., the nurse. It is estimated that 10% of nurses have a substance use disorder. Alcohol, again, is the most widely abused drug, followed closely by narcotics. So there are several signs or clues that could indicate a nurse is impaired by a substance. A lot of these are observed by peers or by management. Some of them are even part of daily record keeping through pharmacy and other chart auditing. So these are things like high absenteeism, an increase in wasting of drugs, incorrect narcotic counts, difficulty concentrating and meeting deadlines, relationship problems, inappropriate responses, irritability, isolating behaviors, elaborate excuses for behavior, an unkept appearance, impaired motor coordination, patient complaints, and discrepancies in documentation. In cases with a chemically impaired nurse, it is required to report these to the State Board of Nursing, and the State Board actually looks at each of these cases individually. The results or consequences for being chemically impaired can be anywhere from a denial, suspension, or revoked licensure. There could be disciplinary action that's required before returning to the workplace. This could be successful completion of a treatment program, evidence of support group attendance, like a 12-step program. You could be subjected to random drug screening, and then there could also be employment or voluntary activities that are required during the suspension period. And then the textbook goes on to talk about different programs and treatment options outside of the nursing practice. So these are things like Alcoholics Anonymous, which is a self-help organization for the treatment of alcoholism. It's based on the concept of peer support, acceptance, and understanding of others who have experienced the same problem. This is traditionally a 12-step program that provides specific guidelines on how to attain and maintain sobriety. And then total abstinence is promoted as the only cure. There's also pharmacotherapy associated with alcoholism and other substance use. So we have some drugs listed here. We won't go through them specifically, but you do need to read them and be aware of them, and know that this is a treatment plan associated for these disorders. Also, keep in mind that the treatment modalities for substance-related disorders is going to depend on the substance itself. So we have listed here with our alcohol withdrawals. To treat those withdrawal symptoms, we will use drugs like our benzos, our anticonvulsant medications. We're going to promote alcohol abstinence. And then alcohol abstinence, again, we may have some medications that we'll see prescribed. Those are listed here. Just like all of our signs and symptoms are drug specific, our treatment modalities are going to be drug specific as well. So we see here some of the medications used for opioid intoxication and withdrawal. Remember things like Narcan, and then also look at the medications to assist with withdrawal. And then we see here the, again, specific treatments with the pharmacotherapy for specific substances. So we have our stimulant intoxication, stimulant withdrawal, and then our hallucinogens and our cannabinoids, again, all have different drugs used to treat the signs and symptoms of intoxication and withdrawal. Keep in mind that with addiction and substance abuse, it is a long recovery period. So we're going to see a lot of collaboration with different types of treatments beyond just the nursing intervention and the pharmacological treatments. So we'll have things like support groups, counseling, self-help groups, like again with the Alcoholics Anonymous. So these will be resources that we will need to be able to present and make sure that our clients know that they have access to. The last part of your textbook talks about non-substance addiction, and it's important that we remember as nurses and healthcare professionals that these two affect the body and affect the patient in a myriad of ways. So we have our physical and psychological effects of non-substance addictions like gambling. Gambling disorder is a persistent or recurrent problematic gambling behavior leading to clinically significant impairment or distress. So, as the need to gamble increases, the individual may use any means required to obtain money to continue the addiction. This means that they could be not taking in as much nutrients because they're using their money for food to gamble. Or they could not pay their light bill and now they're living without heat, which can lead to all sorts of ailments. So we need to be able to assess these patients as well and come up with innovative nursing interventions that can aid and help these patients. Just like with our substance abuse disorders, we do have some predisposing factors associated with our non-substance disorders like gambling. Those are listed here. Some of the psychosocial influences are loss of a parent before 15, inappropriate parental discipline, exposure to gambling activities as an adolescent, a family emphasis on material or financial symbols, or a lack of family emphasis on saving, planning, and budgeting. And then lastly, here we have some of the treatment modalities for gambling disorder. Remember, this is a non-substance addiction. So we have our therapy, motivational interviewing, 12-step programs. We do see medication prescriptions with the treatment of gambling disorders. Those are some of our psychopharmacological agents like SSRIs. And then also organizations like Gamblers Anonymous. Again, important that we're able to point out these resources and provide these patients with the appropriate information that they may need to help improve their overall health. This ends the content for the PowerPoint recorded lecture. We'll continue with the content in class, looking at a couple of case studies and practice questions. I hope that this has been helpful. Look forward to seeing y'all in class. If you have any questions, do not hesitate to reach out to Dr. Jones, and she will get those questions to me. Thank you.